Okay, so this was supposed to be for tomorrow on a Zoom call, you know. But then I was like, oh, never mind, you guys are off that day, so I'm not supposed to assign you anything. So have a fun day off, relax, sleep in, enjoy yourself, go for a walk. I think it's supposed to be nice out. So we're gonna do this today. I am just going over some pictures of, I almost said Wilson College, of North Paws Vet Clinic, which is in Hagerstown. This is owned by my friend, Dr. Becker. I used to work with her when I was in the field. She's a fantastic vet. Fantastic. She does dogs and cats, any sort of poultry, all birds, pocket pets. She's really good with rabbits, guinea pigs, hamsters, mice. The only thing she doesn't do is large animal and reptiles. Okay? It is a lot. She is really smart. And I just love her. So all of our creatures are seen by her. I even take Rocky and Wilson there. So you know if I take my pets there, it must be pretty good. She sees all the pocket pets from our shop too, as needed. So this is her vet clinic. She started it from scratch. It used to be a, what do you call it, where you repair cars? Like a auto body shop. So she started this from scratch, just gutted it and built this. So there's no particular order. I'm gonna show you some pictures and I want you guys to interact with me and say what room you think you're seeing, what's going on there. I didn't put any words on this at all. So here's the middle of her practice. What would this be? Treatment area, where they do treatments, right? So draw blood, do nails, do dentals, all of their needles and syringes and blood collection tubes are right here. You can see some cleaning stuff there. They have a big old Amazon bird, but it goes home with one of the techs when she's off, so that's why that cage is empty. There's another table right over here that you can do treatments on. And then there's these nice sliding doors for, what do you think's back here? Kennels, big dog kennels are back here. Pharmacy, look at all those drugs. Okay, so we've got computer here. This is where they would enter their notes. I loved this. Do you see this little like flippy thing, you know, where you like flip it and the oil goes all the way down? It's 2 minutes and the vets come out and they sit down and they flip that over, and they have taught themselves that they have to take 2 minutes to write down about that case, because what they were doing was they were taking it home over the weekend and losing family time because they were doing their work over the weekends. So 2 minutes is not very long. They would type up their notes and they would be done with that animal for the day. I thought that was a great idea. What do you think's in the fridge? Any medication that needs to be in there? What else needs to be in there? Vaccines need to be in there. And then one more thing. Well, technically two. Level 2s, what did we do that you guys had to teach yourselves? And I said all of mine are expired. Snap tests have to be in the fridge. Okay, so there's our fridge. There's their break room. It's where they eat lunch. And then these are all their exam rooms. 3 exam rooms. You can see all the cards that they get from clients. They have them hanging up back there. There's a printer to print out labels there. And then you can see more drugs up on those counters and cabinets. All right, this is interesting. What does that look like? A safe. What's in there? Controlled drugs. Okay, anything that could be abused is locked up. And there was a whiteboard and it said something, I forget exactly what it said, something like key handler or something. And they have 2 keys. One is always in Dr. Becker's pocket. And one, it said key handler, it's on a lanyard, and it was on, like, in the pocket of one of the technicians, whoever was signed up for that day. And so that was the only person who's granted access to that safe, okay? To make sure that nothing happens, yep.
Are you supposed to lock it after every time?
Every single time.
Okay.
Do most clinics do that?
No.
No? But they do. And guess what else was written on there? If you are having thoughts of suicide, text blah, 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 blah. Connect with a trained crisis counselor right away or call the National Suicide Prevention Lifeline, blah, 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 blah. Why do they have that on there? You could use the drugs to overdose. That's exactly right. And if you're in the medical field, you know how to work those things. And we talk a lot about compassion fatigue and burnout in the veterinary world. Vets are one of the highest suicide rates in the world. Veterinarians, okay? And so they have this locked, they have that on there. They do trainings about how to handle your emotions, how to handle grief, level 1s. It is a hard business, okay? All right. Kennels, okay. So these are a pretty nice look. Even if they urinate or defecate, it falls through and you can clean it that way. So 3 of those. The bathtub was behind that. And this was in a separate room, so who do you think goes in these? Cats, or maybe a quiet, sick dog underneath it that's not gonna bother the cats. I thought this was a cute idea. These are, you know, like the shoe rack case that our phones are in. They have all their muzzles of different sizes in there. I thought that was nice, but I don't really know where we would hang one. What's that? The lab. Yep. So what do you see there? Oh, there's a safe. What's that? Microscope. What's that? Blue. It's a stain. They have a clean stain, which is what we have here because we just use blood. They also have a dirty stain, which would be for ear slides and fine needle aspirates, which I'll show you a picture of that. Yep.
So when you do like a fecal smear, you know how are you supposed to like do the circle both ears? Why do they like go back and forth instead of doing a circle?
I don't know. When you do a smear, you should kind of rotate it as you're putting it on to make sure you get all different surfaces of the poop. So I wonder if that's why they're doing it that way. They usually, and I think they actually do like a letter, like a Z and an N or something to remember which one's right and which one's left. I'd have to watch them do it again. It's been so long. And then you see them take the lighter and they light the flame under it to dry it. And then they stain it. What's that? The centrifuge is huge. Okay. I have a closer picture of that, I think. Alright, this I could not get a good picture. There's like a glare back to the laundry area, but this room was sealed up, small, not much in it. What would that be? ISO. Yep. Okay, here is their surgery room over here, okay? And then all these cabinets are filled with things for surgery. So these drawers, you could actually push them into the surgery room or pull them from inside the surgery room. Pull them this way to empty them. That way, what don't you have to do? If you're in the surgery room and you need something, what can you do? You don't have to walk in and out, okay? And that means less traffic, which means less air being stirred up and moved around, which means less bacteria floating around in the air and settling into your patient. So I thought that was pretty nice. There's our exact same, what? Autoclave, our exact same autoclave. Here's endotracheal tubes. for the anesthesia machine. What would this be? There's an autoclave. What's the step? Well, what's 2 steps before the autoclave?
The
Ultrasonic cleaner. That's their ultrasonic cleaner. You can see their chemicals there. I think I have another picture. Yeah. This said to be autoclaved, so they just had a pile of things that were like getting ready to be autoclaved. There's a drying towel. You can see into the surgery room. There's some wrapped packs. I think I pulled that drawer open. Pouches, clean, dry, nice and tidy, right? There's your surgery room. So how many tables do they have there? 2. I wish they were doing surgeries that day so I could videotape a surgery, but they weren't. So there's 2 surgery tables, lights, 2 anesthesia machines. You can wheel these over and put your surgical packs on them. Not very cluttered. All of their EKG machine and all of that is there. They can pull up their digital x-rays on that TV on the wall if they're doing like a fracture in a leg or something, fracture repair. What's that? Exam room. What do you notice? The fold up table, yep. So if it's a big dog, they could just put that up. It's nice. What else? Warm, inviting. Simple. Not much in it. Right? Easy to clean. Alright, this is their x-ray room. Radiology. I know we haven't done that yet, level 2s, but we will. This is called a technique chart, right, Hunter? Technique chart. So I just took a picture of that. That's how you know what settings to put the x-ray machine on. But their setup is a little nicer than ours because they have digital, so it goes onto a screen. You don't actually have to develop film. Like those Polaroid cameras, it's not like that. What are they wearing? Yep. What's this? Lead apron? The badge, what is that? Dosimetry badge. Dosimetry badge, and what's she wearing? She's covering her. What gland is this? I thought I heard it.
I think you said it.
Thyroid. Thyroid shield. Radiation loves your thyroid gland. It loves to give you cancer there. So she's wearing that as well. I think she has it on, you just can't see it. So there she is loading the cassette.
Yes. So we are just going to do a lateral. It's crazy.
This is a pregnant dog. See her doing the settings. There's a stationary x-ray table. And she's getting the pedal.
Alright. Okay, you wanna roll all the way?
So everyone needs to stand back so that we don't get zapped, right? Alright, so they're getting her in lateral and then they're gonna snap the x-ray. There's all their other employees' badges. And there's the x-ray that they took. So she's pregnant, but she's not really pregnant enough to see any babies yet. But you can see the start of one's skull right here. So they were trying to figure out how far along she was. Do you know how long a dog's gestation is? How long they carry their babies? 63 days. 63 days. So I think they said she was probably at like day 40. It was her and an Australian Shepherd. So what surgery do you think that female dog's gonna need when it's time? Surely. here are their cage cards. Okay, so each animal that was hospitalized, I just hid the name. So this was a bunny rabbit, it has the name of the clinic, the client ID. So that would be like on their files. Instead of having the names on the files, they have numbers. The patient ID. So this was Charles. Charles was a lagomorph. Do you know what a lagomorph is? A bunny rabbit. He's a neutered male. He's a dwarf rabbit. Time, 9 a.m. It was a drop off. Reason for appointment, sedated teeth trim. So they were going to sedate him and do teeth. I couldn't stay that long though. I had to leave. Notes. Owner said he may bite. That's good to have on there. It has the weight. And then they didn't fill out the rest yet because that was in the morning. So there's allergies, none. Is there a microchip? What was the weight last time? Date of birth, sex, neutered male. So all the information you needed at a glance, right? This was their reception room. Beautiful, isn't it? Inviting, there's a TV there. This is a fridge with water. You can just take water. It's set up a little bit differently here. Usually these chairs are here, but they kind of like barricaded the receptionist because of COVID. Come in and get a hand sanitizer squirt there. And then these are the exam rooms. This chalkboard here, ordinarily when all the clients are coming in, a lot of clients still stay in the car. They're not comfortable coming in. But they would be like, welcome, Fluffy, Bobby, Tweety. They'd like write all of the names. I thought that was very inviting to see your pet's name on the board. Like, we're looking forward to seeing you today. I tried to show you a little bit of fear-free medicine. So fear-free is something that they practice here, and that's what we try to do here, right? We try to give lots of treats. We try to give lots of cheese whiz. We want it to be friendly, make them comfortable here, make it positive. So this girl here, she's a tech, she's an assistant, that's one of the vets. So she's got cheese whiz on that stick there. They're giving it loving. Less is more. They're not like crowding it up to her, but that dog is supposed to be a service dog, and it was scared to death. All right, euthanasia stuff. That is on the front counter in the reception area. And it says, if this candle is lit, someone is saying goodbye to their beloved pet. We ask that you please speak softly and with respect during this difficult time. Thank you for your kindness and compassion. And so they light that candle if they're doing a euthanasia in a room. Have you seen that at any of your clinics? I love that. I think that's a great idea. Now this is the doorway leading to the 3 exam rooms. What do you think PTS is? Because I wasn't there all day. They just put it up during a certain time. Any guesses? Put to sleep. Put to sleep in room 4, so be quiet. Don't make noise in this hallway because we're putting an animal to sleep in room 4. Each of the rooms was assigned to a doctor. So like room 2 was Dr. Becker. This was a dog that she saw in that room. And then she had Wilson for a drop off. And then Charles for the teeth trim. So it just keeps them on track, lets them know what's coming up, and they just keep adding to it as the day goes on. All right, this is interesting. I don't know why that's so far down. Oh well. This is, it's gonna drive me crazy. Whatever. All right, this is a machine that will actually read a urine sample. You don't even need to look at it under the microscope. It does it for you. So you just use this as like a fancy pipette. You still have to use a refractometer to get the what? Specific gravity. But then you use this fancy pipette to draw up the urine, put it in this machine. It projects and labels what it sees in the urine. So this is WBC, what would that be? White blood cell. This is EPI, epithelial cell. And then it tells you less than 1 white blood cell per high power field, red blood cells 5 per high powered field, no bacteria rods detected, no bacteria cocci detected, squamous epithelial, oh my gosh, I wish I had this back when I was in the clinic. How fast and convenient is that? Do you still need to know how to read it? Yes, because what if something happens and this breaks? What if you ran out of supplies that you need to keep it up and running? But I thought that was pretty cool. And you can see all their cheat sheets back here, right? Level 2s for those snap tests are all back here, all the instructions. It's not something that you have to memorize, although eventually you will. All right, this is a fine needle aspirate. So this dog had a hard, angry looking tumor. And so Dr. Becker takes a syringe with a needle on it and she draws cells out of the tumor. And she squirts them onto a slide. She lets it dry. She dries it with a flame, and then she stains it and looks under the microscope. So that will let her see if there's any cancerous cells there, if it's something that should be removed surgically. All right, here is their CBC machine. So that would tell, you don't have to do a packed cell volume anymore. It does it for you. Are they anemic? What's their white blood cell count? What's their platelet count? You don't even need to look at a slide under the microscope anymore. Do you still need to know how to do that? Yes. Then they have these little readers that you don't even have to stand there and snap the snap test. You just enter the information. So here's Wilson. It's a triple test, which means it tests for FIV, FELV, and heartworm. You just slide it in there, and this reader watches the conjugate and blood go through, snaps it, sets a timer, and reads the results for you. So it says FIV negative, FELV negative, heartworm negative. That's Rocky. That's here. All right, and one picture I have, I'm gonna show you videos. One picture I have, those are white blood cells. When they poked his belly fluid, that's what it looked like under the microscope. So I'll explain that more in a minute. Questions so far? All right. So I have some different videos. Let's do this X-ray one first.
Very good. Yes.
I think that might be the same
We
one.
are just going to do a lateral
Sorry.
slicing.
What kind of dog is that? Good. What color is it? Don't think too much into it. What colors do you see? Black and white. That's it. So you see all their PPE.
Alright.
She's looking at me like, get up out the way. Is what does radiation cause? Cancer. Alright. Now, you want to see the heart one again so you can see it better? Well, no, let's do this one first. Let's do this one. This is an ultrasound of his abdomen. So you see they have him in that nice fluffy trough to keep him on his back as comfortable as he can. But you're gonna see eventually. Hey, stop. Did you hear what that was or no? Thank you, Rocky. Okay.
Come to this building. He's so scared.
Looks like this is the most action I've had in probably 14 years. Look how good he's being. I'm supposed to be soon. His bladder. See it? Looks like a balloon.
There's fluid in his belly. That's what this was.
That's what I found. Fluid is the black. Not normal. You shouldn't see any black. Except in his bladder, because that's pure.
Intestines floating around.
Intestines. It's huge.
It's a lot.
It's okay, Why? Make it hard.
You're such a good old man. You're a good kitty. It's alright. Did you hear her say he's panting? That means he wasn't getting enough oxygen, so he was stressing.
We can go while you're like this.
Alright, so they let him go on his side. So Brittany is a vet tech. She's just checking on him, making sure he's back to a somewhat normal color, even though his color's normal.
So that's his liver.
His liver. Good old man.
Fluid around his liver. That's abnormal.
Mm-hmm.
That's why the liver looks normal.
That's one good thing going for him. She's taking pictures down below. Do you see that? So she could send those to a specialist if she needed to. You're a good old man. You're a good old man. Alright, sir.
No, he's fine. He's pretty decent.
Is that like a lobe of the liver when it changes shape like that?
That's what I'm trying to figure out where his spleen is, because we're on the left.
Uh-huh.
We need to look a little bit darker, real long like a tongue.
Yeah.
So I think that's all liver, but I'm not completely convinced because I haven't done the spleen yet.
Mm-hmm.
That's a shadow. Go back to that.
I told you he'd be an interesting one.
That's definitely interesting.
Did you feel his belly, Brittany?
It's just,
A water
I
balloon.
was gonna say, fluid waves.
Yeah.
Did you tap it?
No.
Hold on, let me
See the kidney? Look at it. Doesn't it look just like your pictures? Sliced tomato. Look at that. At least his kidneys are normal.
Right kidney.
We just had a lecture about the urinary tract.
Right kidney. Looks like a cut tomato.
It does.
That's very nice. I'm sorry, buddy.
Isn't that crazy? Put all the fluid in there. Black.
Try again. Alright.
All of this is really bright, like all this fatty fat is really bright. I don't know what this is. That's what it looks like.
Yeah.
It doesn't have distinct borders.
No, it's not. Say that, so she said it's bright and there's no distinct borders. So that's all cancer inside of them. That fuzziness is all cancer.
Sweet boy.
Says, oh my gosh, I haven't been touched this much in 14 years. This is crazy.
You're a good boy.
See it? It's all cancer. What is it attached to?
That's what I can't figure out.
It's just like the whole thing.
Pancreas?
Mm.
Cranial to the liver.
Is it?
Yeah.
So it's even all
It's
over
sort of
his
wrapped in
liver.
the liver.
Mm.
You're a good boy.
You're a good boy.
Almost done.
You're a nice cat.
Okay, buddy. Let me get you a needle.
Alright, now, remember that picture that I showed you? And I said, let's see. Where is it? Oh, there it is, okay. If you're squeamish, don't watch. It's not like he cries or anything, but they're gonna poke his belly. Okay? So if you feel weird, you need to lay your head down.
It'll be fine.
So she's gonna
It'll be fine. We'll just go.
look for a spot that's just fluid. He doesn't even
Little
flinch
Ken,
for it.
speak for yourself.
So they're just using alcohol to get the area clean and so they can see for the ultrasound. But she doesn't want to poke his organs, she just wants it fluid. So I think I showed the screen.
Come on, buddy, be brave.
See all the black? So she's making sure she pokes the right place.
Brave boy. Good job.
See, you didn't even move.
Good job.
See that?
Ooh.
White fluid.
Clear. Well, it's not if I do.
Or what would that be called?
I mean, it still could be.
That procedure, poking the belly to remove fluid. What did she poke? His abdomen. What's surgical puncture to remove fluid? So abdominocentesis. Alright, so this picture here, that was of that white fluid under the microscope. And all of those are white blood cells called lymphocytes. So that's how she could tell that he has lymphoma, is because his abdomen is full of lymphocytes. That make sense? Alright. Here she is doing an exam on him.
Actually, Kristen, if you wanna hold on to him, then Lisa can videotape what we're doing.
She is weighing him.
He's a nice boy, if you don't mind. I'm gonna ask this fine. Come on.
There's his chart there.
I love cats, I just hate having my picture taken.
Oh. Here, I'll come this way then. Look, there you go.
It's fine.
Did you see what her jacket
Well,
had
does
on?
it make you feel better it's a video instead of a picture?
So I have to be singing on my
I'm not gonna show you.
jacket. It's a top. But look, it's meant to be. 'Cause look at the
Right,
jacket.
okay.
That's where he came from.
Wilson College. Come on, it's perfect.
It's fine.
This is your time to
There's her
shine.
treatment board. You see the big white board in the back?
Wilson,
Hi, Wilson, let's take a peek at your body.
You're a good boy.
a good old boy.
Do you feel like he's been losing weight?
No, he eats really good. I think his gums look terrible.
Ooh.
So they put him on Clavamox for 10 days and Doxy for 10 days after getting that blood work.
Where was this?
In Virginia. So I've only had him for like 12 days.
Okay.
So she's looking at his teeth, but she's not getting bit. She's holding by his cheeks.
Yeah.
Alright, so let's move on to Dr. Becker. Rabbit, Dr. was consolidation, I've had another can with strawberry daiquiri flavor. He left it out 8 hours overnight, is that
So
normal?
here how everyone just comes up to her while she's doing exams, like that's normal. It's so high paced.
Okay.
That is.
He's not gonna touch you.
It's like a balloon. He eats great, he drinks a ton.
Okay. Any vomiting or diarrhea?
Nope. We got a stool sample, so they're gonna send that away. He left a present in his cage for me on the way here. It's very kind.
What's his body language?
Alright, sir.
Look at her listening to that. She's like, what the world?
All first today. significant sinus arrhythmia, so as he breathes, it speeds up and slows down. But I had to make sure because it was kinda all over the place there for a bit.
Yeah, I didn't know if it was his heart, and that's why, I mean, I don't know if that's fluid or what. Isn't it bizarre?
You can do ultrasound, that's the fastest way.
Okay,
And cheapest.
that's kind of part of this. Is like the school's paying for it, so I can't do anything extreme. Like, I'm not gonna do heroics. I just want him to be comfortable, and if he needs something that I can give him, that's fine, but
This is really
it
weird.
is very weird.
Alright. So that's it for Wilson. You have any questions on Wilson? You guys like this? Yeah? You don't need to see the heart one again, right? Alright, now let's watch. You wanna see him draw blood on Wilson? Okay, again, if you're squeamish,
Side.
lay down.
I'm not gonna stress him out with his neck.
Yeah.
Or we can do a front leg, either one, whatever's.
Alright, so look at this little picture here, right? See, he's in
Go. Good job,
femoral
buddy.
right there. See, they're feeling.
Try not to scratch.
Well,
Yeah,
he's
it
anemic, right?
to it,
So
I
do you
know.
think he has much
Yeah,
blood for
just
them
a
to feel
little.
a vein? So they're like trying,
He scratches.
can't feel it. So now they're gonna try jugular, which is right here. Right, is that how we do it?
I told you.
Do you see why I don't like it that way? Right? Like if he had claws, he would have just scratched her. There's not really much you can do. So then they were like, oh, like maybe I can try to hold his paws down, you know? But you can only do so much with that. Let me see. But they didn't want to do lateral because that's when he started panting back in the room, was that much restraint. So we did get it this way. I think you can see. There you go.
Is he front or front paws?
He has one
See,
deep
she has
claw
to
they
see a
missed.
front paws.
Just one.
Alright, so
He's
she's
really tense now.
shade them so she can see better. You should ask the owners before you
Ow.
shade.
That's my arm. Hi, sweetheart.
See her rubbing
Just
in.
lean a little bit.
She's holding in that throat latch.
Move it up. Just move it up.
Good
Okay, she's got a butterfly catheter hooked up to it. That way if he does jump a little bit, it's not gonna be as hard as a
Good boy. Look at that.
needle.
Nice job, Brittany.
Sorry, I took the mask off, but it's like, I know it's right there.
Alright, now let's watch how she puts it in the tube and see what she does.
Okay, I'll be
What'd
back
she
in a
do?
second.
Stuck the needle in it. What did I tell you guys about that? Breaks
And we're
the
just
cells.
starting with the top,
I didn't like to see that, but I told you guys that it happens. Alright, let's watch saphness on a dog.
I saw Hamilton this weekend. Okay? I saw Hamilton this weekend, finally. Yeah. I didn't care for it very much. I didn't really. I guess there was so much fire about it. I really wanted to, I think I would love it.
Yeah.
Have you guys seen it at all?
See how they can move a little bit once you get that butterfly catheter in? I didn't use butterfly catheters a whole lot just because it's more money and it's good to be frugal. So I didn't use that much. But it would have been nice. We were just too cheap.
Right.
Okay, IV in a dog. So this is a 16-year-old dog that is blind and deaf. And they're putting in an IV catheter because they're gonna euthanize it in the room with the owner. So they shaved it, they cleaned it all up.
Not much way in the words of comfort. I got a pretty good walk on my own
Hold on. I want you to see,
She's
watch
blind and
the
deaf.
flashback. I tried to get it there.
Not much way in the words of comfort. I got a pretty good walk
Alright, look,
on my
do
own.
you see the blood right there? Right, and did you Alright, watch. So she pokes, see her finger move up and she threaded that tube in. So that's that floppy, flimsy tube that doesn't hurt, and she took the needle part out.
Not much way in the
So
words
now
of
you'll just see her
comfort.
taping it in. Do you see how she let her thumb up? Because if you have your thumb down, the blood keeps flowing and then you have a mess. So she's just holding behind the elbow now. See the blood up there? Means it's in.
I was gonna say, I don't know why you put them on. I put them on because she was covered in gross drool and I didn't want it on me.
You don't normally wear gloves, but the dog was like drooling everywhere, so she didn't have drool on her. I wouldn't have done that either. So that's an injection cap. They're not hooking it up to IV fluids. They're just gonna inject the euthanasia solution right into the vein. So the dog can't see or hear, but you see her scratching it, loving
The
on
noise
it.
is kind of breaking my heart a little bit.
Hear it breathing.
He says she's got like a bruise or anything, something that's kind of big. And this is a pretty good age for any dog.
How old is she?
Almost 17.
Wow. Amazing.
Look like a, I don't know, maybe like a Pomeranian.
Oh wait, there it is. It's like way over here.
I was gonna say, it's going in very well.
Yeah, it's like way over here. Probably
So that was just saline, and they're just putting it in to make sure that it's called patent, means that it's flowing, flushing, and that way they know when they get in the room, it'll be ready to go. There's just one more. I'm not gonna show you this whole thing. This vet comes in like every other Wednesday, and she does chiropractic work and acupuncture on dogs and cats. So this dog has cancer, and she's doing, it's actually a laser, you'll see it in a second. But she's putting it at pressure points to try to get his immune system to work better.
Because he just is like.
She's here, and it just generates
Yes.
like warm pulses.
You got it, about 30
And
seconds
she
or
just
so.
puts it on
And
there.
just keep moving all over.
So is it class 3 laser then?
This is just an infrared.
Oh, okay,
Yeah.
cool.
Yep.
Cool.
Yeah.
So I wanted to ask.
So I'll just show you.
So that
real quick.
their vaccines like.
You could actually see him, he actually like relaxed, look at him, look at how calm he is.
Yeah.
Until his mom walked by. His mom is at other vet.
Okay.
We're training to be.
See her holding it? That's just a pressure point.
to help me.
I love that. I do. It depends on the.
So I just wanted to show that because that's a different option you could have in the vet field is, it's called holistic medicine. Oh, it got really quiet. Okay. We have 15 minutes. What questions do you have? Please tell me you have questions. Cause I was there a whole day for you. Really? Okay, well, what did you think about it?
There's a lot more room than Franklin.
More room? What else?
It's more organized.
It looks very updated, like a lot of like pictures we use and like on the internet, it's like basically YouTube, but that had a lot more like new, I don't know what you wanna call it, like,
more modern.
yeah, like the drawers going through to the surgery room, that's not something you typically see on TV.
What else? What did you think of the text job versus versus the assistant's job versus the doctor's job. Did you tell who was who? Did it make you think, oh, maybe I wanna be a tech, oh, maybe I wanna be a vet, maybe, did you get any thoughts like that? Okay, well. Alright, well, you're not done with it. You're gonna go to Moodle. You're gonna go to miscellaneous, MISC, and you're gonna click on describing wheel. And it's just what it sounds like. Alright, it's a wheel and it has this many spaces. You're gonna write North Paws / Wilson. And I want you to write either something you learned in the little sections, something you learned, or something you found very interesting. You have to fill the wheel. Okay? You should surely be able to do that, because that's a lot of pictures and detail. Alright? Honestly, I think you guys can do that before you go to lunch. So, if you wanna email it to me, you can. If you wanna like write on it, if you wanna print it out, I don't care. Some way.